Chronic pain, defined as pain persisting beyond 3 months, is a major global health issue affecting millions of people. It can stem from conditions like fibromyalgia, complex regional pain syndrome, and neuropathic pain, leading to significant suffering, reduced quality of life, and functional impairment. Despite advances in medicine, many current treatments, ranging from medications to physical therapy and psychological support, often fail to provide adequate relief. This ongoing struggle highlights the urgent need for new, effective therapies. Recent research has turned attention to the role of tissue hypoxia and oxidative stress in chronic pain, suggesting that addressing these underlying mechanisms could open new doors for treatment. This is where hyperbaric oxygen therapy, or HBOT, comes into the spotlight as a promising adjunctive approach. Hyperbaric oxygen therapy, or HBOT, involves breathing pure oxygen in a pressurized chamber, typically at pressures between 1.5 and 3 atmospheres. This process dramatically increases the amount of oxygen dissolved in the blood, enhancing tissue oxygenation, especially in areas affected by poor blood flow or inflammation. The increased oxygen helps reverse hypoxia, suppresses inflammatory pathways, reduces harmful reactive oxygen species, and promotes tissue repair. These effects may help break the vicious cycle of chronic pain by targeting both peripheral and central sensitization. While HBOT is already used for conditions like carbon monoxide poisoning and chronic wounds, its potential in chronic pain management is now being explored through clinical trials, particularly for fibromyalgia, CRPS, and neuropathic pain. Recent systematic reviews have analyzed 11 randomized controlled trials involving 480 adults with chronic pain syndromes. Most studies focused on fibromyalgia, with others examining CRPS, trigeminal neuralgia, and radiation-induced brachial neuropathy. The results are promising. HBOT led to significant reductions in pain intensity, improvements in quality of life, and better overall functioning for many patients, especially those with fibromyalgia. Studies even reported that up to half of HBOT-treated participants no longer met diagnostic criteria for fibromyalgia after treatment. However, the evidence is not uniform. Benefits were less clear for other pain conditions, and some trials failed to show superiority over placebo or sham treatments. Methodological limitations, such as small sample sizes and subjective outcome measures, mean that more research is needed before HBOT can be widely recommended. HBOT appears to be generally safe, with most side effects being mild and temporary, such as ear discomfort or minor barotrauma. Serious complications are rare but possible, so proper screening is important. Despite encouraging results, the current evidence base has notable limitations. Most studies involved women with fibromyalgia, sample sizes were small, and protocols varied widely. Additionally, the challenge of designing convincing placebo controls for HBOT complicates interpretation of results. To truly determine HBOT's role in chronic pain management, larger standardized trials with longer follow-up and better controls are needed. Researchers also suggest integrating neuroimaging and objective biomarkers to better understand how HBOT works and to identify which patients are most likely to benefit. In summary, hyperbaric oxygen therapy offers hope as a potential addition to the management of chronic pain syndromes, particularly for fibromyalgia. While many patients have experienced meaningful improvements in pain, function, and quality of life, the evidence is not yet strong enough for routine clinical use. The field awaits larger, well-designed studies to confirm these findings and to clarify which patients will benefit most. For now, HBOT remains a promising but experimental option in the complex landscape of chronic pain treatment.